in the literature, we have seen that even just views outside your window in a hospital of even a tree versus another building or being in a wall changes the way people feel pain. So this was a study that they did in people who had surgery. They had less pain, they took less pain medication. The nurses believed that they also had less pain, and they had shorter lengths of stay. You know, putting a plant in a waiting room in a hospital environment, even a fake plant, can change the way people experience their healthcare and how they feel when in that waiting room. That affects stress, that affects healing and health. It is really, it's been shown in so many different ways to be so important to our health. People with mental health issues or illnesses, nature or being in a forest outside has been shown to improve their control of their own illness, including some serious mental illnesses. It's been shown for children with behavior or ADHD that being outside in a natural environment can help them control their own symptoms. That even putting a little bit of green in a playground can change the way children behave, less aggression, less bullying. Being out in a park and having access to that can make people feel like they have social connection and feel less isolated. Part of it is actually the prescribing of nature. So we're hoping that as well with our patient and family advisors and with Child Life as well, is empower families to ask healthcare providers. We're also educating healthcare providers about it, to have a conversation to actually prescribe it. So part of it is have a conversation about nature and getting outside and what they think is important, or inside. They can also choose from a list of connections that we can provide, but there's, you know, many more in design connections, like what they think is, as an inpatient or an outpatient, what they can do, and then having a follow-up conversation about it. So that's our prescribing, so that we are facilitating these connections. Also, we have some funding to start developing these spaces. So some of these things that Nicole was saying in terms of getting more images and pictures for children and youth that they can have, creating scavenger hunts for the naturalized areas around the hospital. We also have pictures and posters of all the indoor and outdoor naturalized areas. We also hope to, for some of the darker rooms where there aren't windows, create lighting, so it's natural lighting that children and youth can have, and eventually as well developing more outdoor spaces for children and youth and our patients to experience, as well as more indoor spaces. And as we expand this funding, hopefully we'll be able to do even more of that. You know, another thing that we've heard is that if they're here for a long time, a number of them would love to be able to care for a plant or have those as an outdoor patient. So we're talking about how we can integrate plant life in this, sound machines. You know, the options are endless. So right now we're starting with the things that we can feasibly do, like some of the highest need areas, and getting photos and pictures. And then hopefully with time, we'll be able to do more and more. We've already seen though, because of this, more nature-based art is appearing in the hospital without us really saying anything, and spaces that you're developing as well are really important part of nature.
Yeah, realizing Indigenous spaces is connecting. When you look at art, Indigenous art, there's stories and teachings and meaning, and so having the kids see themselves in the hospital, really huge too. I'm excited.
We've heard from the youth and children and families in hospital as well about why this is meaningful to them, and we've heard lots of different things that really reflect what Nicole was saying. And I think one of the big themes is a bit of an escape and forgetting and just being a kid. And you know, to be honest, sometimes being in hospital can just really be boring, and you might not be able to do the things that you know, some of our youth who are in school and here for some time, they've said they don't really want to do homework then, but being able to concentrate on potentially, you know, caring for a plant or making sure that they're having a connection every day. There's something about that routine that our youth have said that's really important. And they've even said, you know, maybe their parents don't really understand or the family doesn't understand, but when you've had an illness experience, you understand how important healing is. And that's a physical illness, a mental, emotional, spiritual, you know, all of these things are so interconnected.
I think it's like creating that opportunity, right? Like if we don't have it, then we don't get to have that opportunity. And so like having a healing garden, or having, you know, visuals, or even having plants, or even, you know, having the kids, you know, having a garden group in January, having a garden group in that time of year, so that we can get ready for spring, and so we can be curious about what can we plant and what can we grow, and that there's hope, and we can sort of, you know, plant stepping stones, really plant those seeds for the future for these kids. Like, get excited about healing, and it doesn't have to look a certain way. We can look the way they want it to be. How can we walk with nature in the hospital as part of their healing? And so, is it going outside, or is it going to the healing garden already? These are things that are just starting to be here. But how can we support these conversations, and, you know, having the signage everywhere? Tell me more about that. I'm curious. I know about land-based healing. I know about nature, and I know about creation. And tell me how I can do that here, right? So just inviting those questions so that they can ask their healthcare provider.
It makes me hopeful. Are we able to really bring some connection and support our children and youth? One of the things that, you know, as we've sort of launched this program, it's kind of taken a life of its own, and that's been really joyful and exciting. And we've seen this spill over into creating connections with the community and with researchers at Western, and we're creating a lot of active partnerships and with other organizations who are really excited about potentially helping us develop more spaces inside and outside, so to talk about nature prescribing and how we can work together, and how this can all spill in and out of it to support youth mental health and well-being.
Having these conversations, you see that this is something that people are thinking about. I mean, it is bridging that connection to community, partnerships, awakening sort of like this. Let's have these conversations. Let's see how we can improve children's mental health.